Hi everybody. So today I'm going to do a virtual lecture since I can't be in class. The topic today is eating disorders and disordered eating. The thing I wanted to emphasize most in this is what differentiates an eating disorder from disordered eating and how that differs from feeding disorders. So I know we typically just talk about people having eating disorders. You know, this person has, even if it's technically not. And the reason I say that is because eating disorders have to meet certain diagnostic criteria in the DSM-5, which is the Diagnostic and Statistical Manual of Mental Disorders, and that's the 5th edition of it. So it's the psychiatry manual that clinicians use. And so technically, if it doesn't meet one of those criteria, it would be more under symptoms of an eating disorder or eating disorder behaviors or disordered eating behaviors. So basically, disordered eating is more general. So when we talk about someone who has disordered eating, we're talking about someone with abnormal and potentially harmful eating patterns. It's a general term, but it doesn't have diagnostic criteria. So someone doesn't have to meet certain criteria. Basically, like I've said before in class, is that it becomes problematic when it starts to really negatively affect someone's health or life, when it becomes all-consuming, or like I said, when it starts to affect someone's health. So disordered eating just means abnormal and potentially harmful eating patterns. So it's a general term without diagnostic criteria, and it may develop into an eating or a feeding disorder. Generally what I'm talking about, there's different motivations when it comes to disordered eating and eating disorders as well. So sometimes we often think of disordered eating or eating disorders having to do with a fear of gaining weight or something to do with body shape, but it can also be a feeding disorder. A feeding disorder refers to the idea that the motivations are different. So this would be someone who really can't eat, maybe because of texture or, other things like fear of eating that has nothing to do with body weight. So those are more feeding disorders. Maybe a child who is extremely picky and won't eat, and to the point that it's affecting their growth and development. So it's really comes down a lot of times to motivation, as to kind of how we categorize it, or cause, I guess would be a better way to say that, when it comes down to causation. So it's pretty common. 22% of children and adolescents worldwide show disordered eating. So again, this could fall into feeding disorders. This is from the National Eating Disorders.org. Individuals with a higher body weight have 2.45 times greater chance of engaging in disordered eating behaviors as patients of normal weight, but they rarely receive clinical diagnosis because usually others don't notice as readily or don't take it as seriously unless the person is very obviously underweight. So that is definitely a problem. And it's even a problem with people who have eating disorders, because they can often think, well, I can't really have an eating disorder, or my eating disorder isn't bad because I'm not underweight, and also, so that's a huge problem. It's a problem in getting treatment. It's a problem in taking yourself seriously. It's a problem in other people taking you seriously, but it doesn't mean that it's not a problem. So there are some hyperlinks attached in the next few pages that you can click on, and they link back to the Diagnostic and Statistical Manual of Mental Disorders, which I'll just refer to the DSM-5. And if you click on this link here, I don't think it'll show up in this video. Yeah, probably won't. But you could click on that and kind of get an idea of what types of feeding and eating disorders there are under there. We'll talk about the ones that are motivated by more body dissatisfaction and tend to fall more in the realm of not feeding disorders, basically. So we'll kind of stay more away from the feeding disorders, like ARFID. There's one. ARFID, the Avoidant Restrictive Food Intake Disorder, which is shortened to ARFID. And that one, people generally do experience significant weight loss, nutritional deficiencies. They may depend on a feeding tube or other nutritional supplements to survive. And it does interfere with their psychosocial functioning, but the motivations could be different. So it's less to do with, so it's different from, say, anorexia nervosa, because the motivations are different. It's not about fear of gaining weight or body fat. It's considered a feeding disturbance. So a complete lack of interest in eating, avoidance based on sensory characteristics, concern about like negative consequences of eating, like feeling sick or throwing up or something like that. So someone may maybe look like they would have anorexia nervosa in those situations, but again, it will be diagnosed differently and for different reasons. So as I mentioned before, the DSM-5 is the manual for eating disorders. So here's just a few general eating disorders statistics. About 9% of the population will have an eating disorder in their lifetime. It's usually women, but only a small percent, about a quarter, receive any treatment. So that's why it's hard to get good numbers, because we definitely don't have numbers on people who suffer from disordered eating. But even eating disorders are hard to estimate because most people don't get treatment. Fewer than 6% of people with eating disorders are medically diagnosed as underweight. So that emphasizes what I was saying before about it's taken much less seriously if someone is not clinically underweight, which would be a BMI of 18.5 or below. But health problems can occur at higher body weights. So someone can lose so much body fat that their body is not functioning properly, especially for women. Again, your period may stop before your BMI gets low. So there could be many negative consequences. It could be a high percentage of body weight that you've lost. And people may notice, oh, you've lost a lot of weight, but unless you're extremely thin, a lot of times people don't necessarily think you have an eating disorder. So Eating disorders it shows that in emergency rooms, 16% of adult patients screened positive for an eating disorder. So again, it's common. Anorexia has the highest case mortality rate of any mental illness, and opioid use disorder is a killer, a huge killer of people in the United States. So if you separate that out from other psychiatric disorders, anorexia would have the highest. And the reason is because there's an increased risk of suicide, but more than that, it can kill you. The body will shut down. There will be heart attacks and other health problems. And I know of people, not personally, but people I've interacted with in my life. There's been some young people who have had heart attacks because of bulimia or anorexia. So it's definitely serious. And sometimes the lifelong repercussions are extremely serious, like developing osteoporosis and having the bones of an 80-year-old at 20. Also, there's also the long-term fertility effects. So some people can never regain their fertility after they've suffered an eating disorder when they're younger. So those are some examples of lifelong consequences of suffering from an eating disorder. Usually the shorter amount of time you have it, the less long-term complications there are, but it can be but the longer it goes on, the worse. And also the longer that you go without treatment, the more likely it is to become a problem that you can relapse from. So eating disorders have a high relapse rate. It's very hard to, because it becomes such an entrenched coping mechanism in your life, that it's very hard to come back from it. And people tend to really struggle with it their whole life in some capacity, even if they're quote unquote, it's kind of like someone with alcohol use disorder or opioid use disorder. There's always that chance, of relapse. So even if you're doing really well, you always have it in the back of your mind. So it's really hard to get over, or recover from. So again, there's one death every 52 minutes as a direct result of an eating disorder. And then eating disorder sufferers, more likely to attempt suicide. And a lot of that has to do with your brain needs nutrients in order to function properly. You can't even treat the symptoms, the mental health symptoms of an eating disorder until you get some weight and some nutrients recovered. So in other words, if someone is so malnourished that their brain just isn't functioning properly, then even giving them medication won't work because the neurotransmitters aren't there. So the brain is not healthy enough to even recover at that point. So it really does become a very vicious cycle. So until somebody regains some nutrition, then the psychiatric sides of it could be treated. And also there's depression is exacerbated, and anxiety is exacerbated with malnutrition. So males, it used to be more thought of to be like female disorder, but we're seeing it so much more in men. It used to be about 10% of all cases of anorexia, for example, were in men. 10% were in men, and now we're up to, I think, about 25%. So it is not gender specific, although the rate is still higher in women. I would say that men have overall different pressures. And for example, their pressure tends to be more muscle related. But again, it doesn't exclude the pressure that men and women feel from society about in relation to their bodies and how their bodies, quote unquote, should look. So here's a list of the feeding and eating disorders. And as I mentioned before, there's really 3 main eating disorders. There's anorexia nervosa, bulimia nervosa, and binge eating disorder. And then there's this OSFED category, which does capture some eating disorders that don't fit the exact criteria for some of these others. So in other words, if someone meets most of the criteria for anorexia nervosa, but for example, their weight isn't low enough or something like that, they might fall into the OSFED category. But just so you're aware that to be diagnosed with this, there's specific criteria. Bulimia, same thing. Binge eating disorder, same thing. And then we'll talk about OSFED, but that does also include other feeding disorders. So anorexia is the first one we'll talk about. And you don't have to know the diagnostic criteria for it, but just be aware of, in general, what it means, which I think most people do because it's pretty common, commonly known in society, I would say, of what it is. But sometimes people call it anorexia, which anorexia technically just means without appetite. So anorexia, you can have anorexia because of cancer, like no appetite, but anorexia nervosa is technically the full term for the eating disorder. So as I mentioned before, all of these are hyperlinks to Psychiatry Online, so you can read more about it if you're interested. But the diagnostic criteria for eating disorders, you can see restriction of energy intake to the point where you're not meeting your development. If you're young, still growing, you're not meeting your growth and development. Maybe it's hindering puberty or fertility or physical health. And this is a big one. It's the motivation, as I said before. So it's because of an intense fear of gaining weight or becoming fat. And there often is so much body dysmorphia or weight dysmorphia that plays into that. So people don't see themselves realistically. They may see themselves, or they may see like skin or normal amounts of fat as being, just obese, or, they see themselves just much larger generally than they really are, or having so much more fat than they really do. So there's a loss of sense of reality. And then disturbance in the way in which your body weight or shape is experienced. In other words, that you're hypercritical of yourself for anything related to your weight, you know what I mean, or your body. Like, you constantly think about it. You deny how serious it is. You don't see how serious it is. You kind of don't care how serious it is, because disease or death, when you're in the depths of something so kind of messed up and difficult as an eating disorder is, it's really hard to see the forest for the trees. You know what I mean? It's like the only thing that really matters is the control you have over your body weight. And you just see anything that's bigger than the minimum as just unacceptable. It's just unacceptable. So, other words, you see yourself as completely invalid, and almost not worth existing if you are not thin, quote unquote thin, it's just, yeah, it's crazy. So it really affects how much you value yourself, how much you just think you deserve. There's just so much wrapped up in it. So that's why it says self-evaluation. So, and then, some things that research has shown, that some things that link people to having a higher chance of having an eating disorder like anorexia is that temperament. So having an anxiety disorder or obsessive traits, traits of obsessive compulsive disorder or obsessive compulsive personality disorder, or just even having obsessive traits. I would say along with that is the perfectionistic personality, which, sometimes is diagnosed as OCD or OCPD, but just really having that perfectionistic, like nothing is ever really good enough. You hold yourself to a much higher standard than you should, and things that you do just never really feel like it's good enough. Especially parents who are very controlling or very comment a lot on your body or your physicality, or, there's some type of issues at home, in that way. Your parents may have, or other people in your life may evaluate you and your body a lot, and that they put a lot of stake into weight and eating and health, and they also maybe belittle people who are outside a certain body weight spectrum, make comments and derogatory comments, and those things. If you grow up with that, it will shape your perception of weight and how it affects other people's perception of you. So you have to take that very seriously, and realize that that's not reality, and then, so living in a culture where being thin is valued, and you can definitely say that in our culture in the United States, that is definitely true. And then people who work in fields that promote thinness, like modeling, being in dance of any type, athletes, actors, public figures, even, being on cheerleading or gymnastics. There's just so many things, or maybe even your friend groups, can also influence you. So those are examples where it can help promote that disordered eating. There's so many other things, horseback riding, like, there's a lot of things where, kind of weight, may be part of it. Wrestling for men. I know, wrestling was a really big thing in my high school. And it was, I've talked to so many men who went through that, and, it kind of breaks my heart, because there's so many things that they do to make weight or to keep weight that is so unbelievably unhealthy. And I've talked to some of them as adults, and it never really leaves them. It really, really gets into their heads as well. And really they develop an unhealthy relationship with food and eating, even as they're older. I know one of my friends in high school, he was on the wrestling team, and his father was a wrestling coach, and they put so much pressure on him and his brother, and he ended up committing suicide at a very young age. And I don't want, I do wonder sometimes if that pressure and all of that really, really, got to him. So, genetics, people who have a relative who've had an eating disorder are more likely to have an eating disorder. And then, so these are some of the health consequences. I've talked about some of them already, but, over time, the lack of improper nutrition Too little calories, too little nutrients can wreak havoc on the body. And sometimes that's really hard to come back from. So if someone is really, has a long-term anorexia, it's anorexia nervosa, it's that use it or lose it mentality. So eating, not only once you stop kind of eating regularly and really restricting your food intake, going back to eating, it can be hard, because not only the psychological part of eating, but also the physical part of eating, it may actually make you sick until you kind of get used to eating again. And there could actually be refeeding syndromes that occur. So as I said before, deficiencies, osteoporosis, anemia, from a variety of different deficiency diseases, especially iron deficiency, anemia, fertility problems, and then death, as we talked about before. So the second major eating disorder is bulimia nervosa. And bulimia nervosa is characteristic of binge eating, which just means consuming a quote unquote large amount of food within a 2-hour period and feeling a complete lack of control during that binge episode. And then both of these things have to occur. So the binging and then the purging. So typically when we talk about purging, we're talking about compensatory behaviors. So at least one time a week for 3 months. You can, that can be vomiting, is the most common, but it could be other things. People tend to not just purge, but they may use medications over the counter or illegal or prescription. They may laxative abuse, over exercising. So in other words, feeling like you need to exercise to make up for the amount of food that you ate. So, and again, the motivation is body shape and weight. And this is distinct from anorexia. So people can have an overlap. So you can have, anorexia with purging, bulimia. You can have episodes where, for a certain amount of time, someone's really suffering from bulimia, and then they may go into more anorexia behavior. So things can switch back and forth. It's rarely cut and dry, but, whatever stage you're in at that time is what you'll be diagnosed with. Okay, so again, the binge eating and compensatory behaviors both occur on average at least one time a week for 3 months in order to be diagnosed with this eating disorder. But again, you can have these behaviors not be diagnostic criteria and it still be extremely serious. If you ever throw up because of fear of gaining weight, you need to take, that's a time where you need to stop and say, okay, this is bad. This is getting bad. This is a slippery slope that I'm going down, and I really need to get this under control before it gets out of control, because the purging itself is so terrible for the body. So what can happen is, and this is not talked about enough, but every time you vomit, you can tear your esophagus, and you can die from that, sometimes instantly. And you never know when it's going to happen. And of course, the longer or more often you have these behaviors, the more likely that is to occur. I remember years ago, I saw a picture that a family put out because they wanted people to know how serious it was, but it was of their deceased daughter after purging, and she had passed away in that position. And they wanted people to know how serious it was that people can die like that. So it's not something to get taken lightly, and it's something that does need to be discussed. And if it's something that even, you did once or do once or want to do, it may be worth talking to a therapist about. It wrecks your teeth and your gums, and also esophagus. So a lot of times dentists are the ones who can tell first because of the effect on your teeth. Electrolyte imbalance. So every time you vomit, you are disrupting your sodium and potassium, and electrolyte imbalance can actually cause your heart to stop. So you can have a heart attack right there just because of that, even if there's not other things. It's just the electrolyte imbalance itself can cause a heart attack or an arrhythmia or death. So, sorry, I keep forgetting to click. So, dehydration and constipation, and then impaired bowel function. So if you want to read more about bulimia, you can click on this link here in the what I've uploaded onto Canvas, the lecture notes. Okay, so then let me just check the time. Do I have the time? Yeah, okay, good. So another eating disorder category is binge eating disorder. This used to be part of the catch-all group, but it's become so prevalent that it's now become its own category. And this is the most common eating disorder in the United States. So the most common eating disorder is binge eating disorder, BED. This is serious, and this is a very common cause of obesity, morbid obesity, super morbid obesity. So, I hate the perception that people who are obese or even people, who just struggle with overweight, that, it's just a lack of self-control, when sometimes it's so, and I would say often, it's so much deeper than that. It is a psychological disorder. It's a coping mechanism. Food is a drug. Food is a drug, especially the highly processed chemical foods we have now. They are drugs. If you've ever eaten something just to make yourself feel better, the power of food and how it can comfort you, and how that can become an addiction. So that's what binge eating disorder is. So binge eating disorder is very similar to, it has the binge characteristics of bulimia nervosa without the compensatory behavior. So it is, again, recurrent episodes of binge eating. So binge eating just, again, refers to eating, quote unquote, a lot in a short amount of time. So it's larger than what most people would eat in a similar amount of time. And so for example, instead of having a few cookies, you would eat maybe the whole package, plus some other foods, for example, or there may just be, sometimes, it can get really expensive too, bulimia. And these are both, think about someone with an addiction. It can be extremely expensive to be addicted to food. I've heard of people who have bulimia nervosa. Being in debt, stealing food, stealing money, like really addict behavior, because they are addicted to that behavior, and it's expensive to buy that much food. So it can be problematic for that reason. So it can really be disruptive. Sometimes people are usually 90, you can say people are ashamed of their behavior. They tend to hide it. It's usually done alone. And sometimes people do things like go to different stores, buy a little bit here, there, and another place, go to different fast food places, drive-throughs, so they're not ordering so much at once. You see that as really common behavior. And it's all consuming. When you are driven to a binge, it's like a drug, a drug addict, needing that hit, it's like all you can think about. You feel agitated, and you can't stop thinking about it until you do it. So again, that feeling of lack of control, like, just dissociation from what is happening, not thinking about consequences at the time, just kind of feeding that addiction. And then, so the continued diagnostic criteria, so you can read a little bit more about this. You generally eat faster than you kind of normally would. You may eat until you feel uncomfortably full. You may not even feel physically hungry. You may just, in fact, sometimes people with binge eating or disorder have completely lost their hunger satiety cues. It's more about addiction. And then once the binge wears off, that once you've kind of satisfied that binge, then you kind of go into the just feeling horrible about it. Like, I can't believe I did that. I feel disgusted. I have no control, just beating yourself up about it, feeling very guilty, promising you're not going to do it again. I need to, not eat tomorrow, trying to think of ways that you can, again, I equate it very similarly to somebody who has a drug addiction where, you may, keep telling yourself, I'm going to stop, or it's over, I'm done, just one more hit, that type of thing. It is very serious like that. So it occurs on average at least one time a week for 3 months. And then it's not related to other, eating disorders. And then you have OSFED, which is, other specified feeding or eating disorders. And, so these are disturbances in eating behavior that do not necessarily fall into specific diagnostic criteria of anorexia nervosa, bulimia nervosa, or binge eating disorders. So although there are a lot of feeding disorders that fall into OSFED, I'm going to focus on the ones that are eating disorder related. So variations of anorexia, variations of bulimia, variations of binge eating disorder. So warning signs and related medical physiological conditions are similar to or just as severe. So just because you fall in the OSFED category doesn't mean that it's not as serious. It just means that, the criteria don't align perfectly, So here are some examples. So there's atypical anorexia nervosa. So you have all of the criteria for anorexia nervosa, except maybe, like I said, you may have lost a lot of weight, but you're still within or above the normal range. So your BMI is still normal. Again, above that 18.5, which again can be so low for people. Like, think about it. Like, if you calculated what 18.5 for you would be, you'd probably be shocked. It's like, wow, that's, really low. And still, 18.5, 19, 20 would still be, quote unquote, within normal range, even if you've lost 60 pounds, 80 pounds, 100 pounds, 50 pounds, 20 pounds, whatever it is. And then you have bulimia nervosa, but it's of low frequency or limited duration. So all criteria are met, except the inappropriate behaviors occur on average less than once a week, or for less than 3 months. And then you have binge eating disorder again, but it's of low frequency or limited duration. So it doesn't happen as often. Then there could be purging disorder, which means that you purge, but so there's the compensatory behavior. So, but it's not after binging. So maybe after a very normal amount of food, like a normal meal, or even a small amount of food, people will still purge that food. So again, it could be a small amount of food, the normal meal, So it's not like quote unquote binging, it's just a purging disorder. And then you have night eating syndrome. This one's a little different because it's actually the combination of a sleep disorder, an eating disorder, and a mental health disorder. So it's where somebody wakes up in the middle of the night, and they tend to eat a lot of food. So this is, again, kind of this habit, I shouldn't say habit, but this disordered, way of being that somebody gets into, where they wake up in the middle of the night, eat a large amount of food, and it causes significant distress and impairment in functioning. And so, again, it's a little bit different than some of the other ones we talked about, because it only happens at night after waking up from sleep. And this does occur pretty often in people who take Ambien, sleep medication, but generally they don't remember it. So it's caused by the Ambien. So Ambien makes you do some crazy things and not remember. Yeah, anyway, so that's different. But I just thought I'd throw it in there since it's, again, it's related to kind of binge eating, but totally different type. So how are they treated? Generally, it's usually starts off with a team of people. So you need to, for severe, I shouldn't even say severe, but for eating disorder treatment, you need a team. So generally you need a medical professional, a dietitian who is trained in eating disorders, or specializes in eating disorders, preferably, and then psychiatrists or therapists who are trained, again, in eating disorders, because you need to work on the cause psychologically, and why it's a coping mechanism, why you do it, what it comes from, unraveling all of those negative thought processes that led to the eating disorder or disordered eating behavior. Then you need medical professionals, obviously, to help with evaluation and treatment of things like electrolyte imbalances, dehydration, vitamin deficiencies, medication when that becomes appropriate, and then a dietitian to help work out an appropriate eating plan. So in the beginning, it may be a feeding plan. Somebody may need to go on alternate nutrition, like a tube feeding or TPN, to get their weight up and get some nutrients in their body. But then generally the nutrition professional works with the patient to come to understand and challenge the eating, and try to come up with a plan that works for both the patient and meets their nutritional needs. So, because it is obviously an issue when somebody is unwilling to eat enough to keep themselves healthy, or to eat the right foods to keep themselves healthy, that needs to change, right? So working, the nutrition, the dietitian, registered dietitian, and the patient will work together to try to come up with a plan, and, slowly introduce new foods, and, and then dealing with all the psychological effects of weight regain, and, the challenges of staying at a healthy weight when that's not what your brain tells you is right. So again, and that could be also when it comes to binge eating, how to deal with those uncomfortable feelings of wanting to binge or wanting to purge, and how not to fall back into those behaviors, similar to somebody who has, an addiction or alcohol abuse disorder. again, how do you stop the temptation of engaging those behaviors when it would feel good at that moment, even though the long-term consequences are negative. Yeah, it's scary, how serious it can be. So, I'm going to end just talking about, some disordered eating cultural examples. So again, these are not diagnostic criteria of eating disorders. So these are not eating disorders based on DSM-5, but these would be disordered eating that again can be problematic and can be serious and can lead to life-altering complications, but they're not officially in the diagnostic manual. So one of them is orthorexia, sometimes also termed Anorexia Nervosa. This was coined in 1997 by a doctor, Stephen Bratman, and it's the obsession, with healthy or righteous eating. So it can be someone just really wanting to, sometimes you see this with people maybe online, who, eat really quote unquote clean, to the extreme, or maybe limit, like vegan, I have nothing wrong with veganism. I love it. I respect it. As someone who loves animals, I completely respect it. I don't follow a vegan diet myself, more vegetarian, but I respect it. But veganism can be a way for someone to limit their food intake, because there's so many things that aren't vegan. So sometimes people in the throes of anorexia, or even in recovery, which I don't think it's terrible as a recovery in the beginning. And I don't think someone should be forced to eat animals if they don't want to, but I think you just have to be careful, because I've seen it used a lot to justify extreme eating behaviors and extreme under eating, like people who are, raw food vegans. There is so little that you can eat, and it's so time intensive, and that it's difficult to even get enough nutrition unless it's basically your full-time job. So that's where it can become a slippery slope. It's kind of this idea of, well, I want to eat clean. Okay, well, I need to cut out processed foods. I need to cut out, again, maybe animal foods, or I need to have food that's only local, or, or people who follow like these carnivore diets, or where their diets are so limited, they're just eating, like raw meat or something. And I mean, that itself is an eating disorder, or disordered eating, 1000%. So somebody who follows a really weird diet, for the reason of changing their body shape, and again, something like this more focuses on trying to quote unquote be healthy, but it can become all consuming to the point that it can morph into anorexia. And there is a video that I linked right here that talks more about the dangerous nature of orthorexia and how it can morph into anorexia and even has caused death before. Another, this one's a little different because it has a medical side to it. This is it's hard to describe, but the motivations are the same, but it really comes down to medication abuse. So diabulimia is sometimes referred to or discussed when people with type 1 diabetes deliberately give themselves less insulin than they need to control their weight. Because if your body doesn't have enough insulin, then it will dump that extra sugar into the bloodstream, which again causes high blood sugar. So that's bad. Very, very bad for the body. But if it's going into the bloodstream and not into the fat cells or the cells to be used for energy, then it's not really quote unquote counting as calories. It's not currently recognized as formal diagnosis, but it happens, especially in young people. But this is just the worst because, as you know, not controlling your blood sugars has extremely dangerous long-term and short-term consequences, and will lead to death. My boyfriend's ex-girlfriend just passed away. She couldn't have been that old. She's probably in her 40s. Early 40s. I'm not sure, but because she didn't have this, but that I know of. But I know that she had type 1 diabetes that was very poorly controlled. And she didn't live, she greatly shortened her life because of not controlling her blood sugars. So it really is a dangerous game to play. So again, there's a nice video, or an interesting video, I think, about this from the BBC. And then the last one I want to talk about is eating disorders in athletes. As I mentioned before, athletes are especially susceptible to eating disorders because it can affect their performance. And then there's something called the female athlete triad, where the low body weight leads to amenorrhea, which is the cessation, the stopping of the menstrual cycle, which leads to osteoporosis. So again, it's basically low body fat affecting person's health. And then one that's more recently been recognized is called muscle dysmorphia. This is a psychiatric disorder concerning obsession with building body mass. We see these guys, and it's usually guys, it can be women as well, but we see these guys all over the internet, don't we? People like, I would say, the Liver King, is somebody who comes to mind, who lied for years about being a quote unquote natural athlete with huge bulging muscles, who came out, of course, he was doping using anabolic steroids. But you have so many more. There's a whole side of TikTok and YouTube and social media and Reddit of these people, who are obsessed, live and breathe muscle, it's all about getting bigger. It's all about their muscles. It's just an obsession. And although, it's just, again, like, it's so unhealthy because it's their whole life. They can't do certain things because it'll affect their eating schedule, or it'll affect their diet, or they can't do this because they're going to miss a workout, or it's just, again, that's where it becomes where you live, eat, and breathe this stuff. Gosh, I remember this guy recently, who I watch. He started talking, I don't normally watch these types of videos, but he did a video kind of talking about this group of bodybuilders that they were kind of following around for a few years, that were in the gym. And, a lot of these guys just were like this. They just lived, bodybuilding and exercise and all that kind of stuff. And a lot of them were, using steroids and things like that. And I think there was one out of all of them that they were following that was still alive. And most of them died very young. So again, it's just, it doesn't mean that it's healthy just because you're doing these quote unquote healthy things, right? Exercise, oh, I live at the gym. Oh, I'm a gym rat. That doesn't necessarily mean, right, that you're healthy. So again, there's another video that's very good, about that as well, that, I would encourage you to watch. So, that is all I have for you today. Thank you for watching.